Hello. Today we are going to learn about assessment of intrinsic capacity of older persons. Today for this assessment we have with us our expert Dr. Chirag, who is MD in Geriatric Medicine from AIIMS New Delhi. This assessment will be in 4 parts and part 1, part 2, part 3 and part 4. We will be taking a break after the part 1, so do not leave. Please be with us. We will join again after part 1 in 1 or 2 minutes. Now if you look at this, IGNOU is offering a certificate program on geriatric health and care. This is basically a 6 months program for capacity building of the youth of our country who are 10th pass with 2 years working experience in a health sector, or 11th pass with 1 year, or 12th pass, and we train them to become geriatric caregivers or geriatric care providers. So these people who join this particular program, they will get capacity building in the form of training in 8 days in a medical college, and in addition to that they will have to go for 2 months training in a district level hospital. Admissions for this program are on, and the fees for this program is 6,500. You can apply for this particular program through an online link available on the IGNOU website, that is www.ignou.ac.in. Now today we are discussing the skills for this particular program for one component of this program, and that is testing or trying to find out whether there is any decline in the intrinsic capacity of the older persons. So as you see here, we have 7 main areas which we'll be testing, and Dr. Chirag will help us to teach you how we can do the assessment. We will be taking the assessment for these various components one by one. So welcome Dr. Chirag, and I think we will start with the basic terminologies, and probably first we will explain you that when we do the assessment of an older person, how we should be careful in certain things that we must take care of. So intrinsic capacity is a new terminology for many of us. Intrinsic capacity is the composite of all the physical and mental capacities of an individual. If you try to understand what it is, in simple terms, it means how well your body and mind function together. And when we try to test this, we test it from 6 components. One is mobility, that is how often or how easily can an older person move, locomote. Then cognition. Cognition is the power of thinking and memory. We have vision, whether he is able to see properly, whether he is able to hear properly, whether he has proper nutrition, and also whether his mental health is fine and he is mentally in peace with himself and with the society. What is the need, for assessment and screening for decline in the intrinsic capacity? So it's very important, because we all know that during old age, the process of aging makes a lot of changes in the body of human beings. We should not think that whatever are the changes that is being depicted in an older person is because of aging. He could be suffering from various problems, and not just one problem, but maybe multiple problems. And all these problems may be affecting his mind, and many times his interaction with the society or his impact of the mind may be also making a difference in his physical capabilities and capacities. So that is why it is very important for us to assess that whether this is part of the aging or whether it is actually some other problems which they are having. So why do we do this? As I was showing you, that why do we do assessment for this? Number 1 is to detect any potential health issues very early. So if we see that, okay, maybe he is going to have a great hearing loss. Just now it's just probably very little, but later on he may develop into a great hearing loss which may impact his day-to-day working. Second, avoid serious impact of decline in intrinsic capacity. For example, he is not able to have good mobility. So what will be the impact? He may fall, he may hurt himself. This allows us for timely intervention, and it improves the quality of life of an older person. For all these tests that we will be doing, all the assessments that we will be doing today, there is a setting that is very much required. you, if are going to work as a caregiver, you may be taking caregiving as a formal occupation of yourself, or you may be wanting to do caregiving to an older person at home. Could be your father, could be your spouse, your husband, wife. So you must be very careful about these things when you are doing the assessment. First is create comfortable environment, and there should be dignity and trust. You must respect the older person. The environment should be private, quiet, and well lit. The person should be comfortably seated, and you should greet him warmly. You should reassure him that we are not going to do any harm to you, and we are just going to do a simple test so that we can help you cope up with whatever problems you are having in life. And we also may need to be culturally sensitive, that in one culture there may be certain things which are accepted as a normal norm, whereas in another culture maybe they don't follow those practices. So we need to respect those practices when we are discussing and giving certain options of what they can do to help in case of decline in their intrinsic capacity. Now another thing is that you must adopt simple and patient-centric tests, because otherwise it will be very difficult for the older persons to understand and to be able to perform. So they should be very simple, just walking, speaking, and we have to first explain to the older person that why we are doing this test and what we are doing, what we are expecting them to do. And each step must be explained to them before we ask them to perform that test. We have to be very patient, as you all know, with the older persons. They may have a lot of questions. They may not understand in one go if we are very fast. So we will have to give time to them to understand what we are wanting to do. And also we will have to keep time for responding to what they are saying. We should not say, nahi, Babaji, aapko samajh nahi aaya. That is not the way to do it. They have not been able to understand. Please explain again. Okay? There are certain tools for all these assessments. You need to follow the instructions of the tools appropriately so that you are able to make the correct assessment. You must record all findings immediately, and then you must report these in your report, and you must also involve family members or other caregivers at home whenever required, because sometimes you may need to ask some questions to the family members. Sometimes you may need to ask them that they can explain. Sometimes language may be a barrier. Okay, so sometimes you may need, sometimes confidence may be a barrier. The older person may feel more comfortable when some family member is explaining him the steps for the assessment. Now, your most important role as a caregiver, you must understand. Why are you doing these assessments? You are doing these assessments because you as a family caregiver can reach the last older person in the community. You can reach that person who does not feel the need, or his family does not feel the need to bring him to a health center because they are not aware that he is having some problem. They feel that probably this is part of the aging. Even the older person may feel that whatever I am experiencing or whatever is my deficiency is a part of aging. So what is important is that by your assessment, the older person as well as the family are able to understand and realize that they may require some intervention. So your role is very important. But you must understand that as a caregiver, you should not overstep what is your role. You should not try to give advice to the older persons. Now, for example, we all know that exercise is important in old age and to keep fit. Now, if, for example, a person is having blood pressure, you want to advise him exercise, but without medical advice, please do not advise exercise, because sometimes you may do more harm than good. So it is very important that you must take medical advice. You must take advice of a clinical team, which could be a doctor, a nurse, a physiotherapist, a nutritionist, a dietitian. So you must in consultation with them or get their approval before you advise. But in certain cases, you may need to refer them also. Which are these cases? Let us see. So there can be just a sudden or a severe decline. For example, sudden loss of hearing, sudden loss of vision could be very serious, and so you may need to immediately refer them to a healthcare professional. There can be certain high-risk warning signs. The person is frequently falling, or he is having too much of weight loss. In such cases, even suicidal thoughts, he may be in acute depression. Again, you may need for referral. Sometimes there is a gradual but progressive decline. For example, difficulty in performing activities of daily living. In such cases also, you require that they should be referred. Now, why should there be early referral? Because in early referral, you are able to catch the problems that the older persons have and they do not go into disability or complications. So, we are going to discuss now what are the common screening tools for functional status. And what is functional status? Basically, these tools will measure how a person can manage his daily tasks. Again, we have few terminologies. One is a functional ability. As we said, we will be screening for functional ability. So, what is functional ability? Now, definition of functional ability is the health-related attributes that enable people to be and do what they value. What does it mean? It means that how well a person can carry out daily tasks and live independently, considering their age and surroundings. So basically you are testing how independent a person is in performing the different activities. So for example, you have a person who is having joint pains. Okay, her joint strength is declining. So there is a decline in intrinsic capacity, her capability of doing work. But does she do the work? Yes, she cooks, she does gardening, she moves around. That means her functional status is good and she is independent. What is the need for assessment of this functional status? Because you can monitor whether there is a decline over a period of time, whether there is an intervention which is required, because if they are not able to perform certain activities, for example, if they cannot cook on their own, then they do need somebody who can help them cook the food for that. Otherwise, what will happen? They will not cook, they will eat whatever is available, they will get malnutrition, they will get nutritional deficiencies. So it is very important. And you can also make better use of all resources that are available for the older persons. So early action will slow down the functional decline. All older persons must be screened for functional decline, whether you feel that they are able to manage their work or not, or whether they are dependent. Still, it is very important to carry out very simple tests to find out whether they are able to do their works or not. There are two types of activities in functional assessment. One is the basic activities of daily living. The very basic activities like bathing, dressing, eating, toileting, moving around. These are very basic activities, and whether the elderly are able to do these activities or not. The second type of activities that we test, so we have a different type of test for these activities. This is called instrumental activities of daily living. For example, cooking, shopping, managing money. And why are they different? Because for these activities, it requires that the older person has to plan. He has to think. So, it is also important that when they are able to do these activities, they can independently live. They can be confident. They can be independent. So we have these various tests for the BHTL, that is activities of daily living, which are the simple activities, as I told you, moving around. So these show whether this is the Carl's index, which shows whether it is independent or dependent. And for the other activities in which they have to think, like cooking, gardening, so for that you have shopping, you have got Lawton-Brody scale. So now we have got Dr. Chirag with us, and Dr. Chirag is doing these tests day in and day out in his institution, and he is very well versed, and so it is best that we ask him to explain how these activities are done. So Dr. Chirag, over to you.
Yes. So first is the CATS index that is used to check the activities of the daily living. So the CATS index consists of the 6 domains that includes our bathing, toileting, continence, mobility, transferring. These activities and feeding also. So these are the 6 basic activities that cover under the CATS index of daily living. So this is the CATS index. As you can see, the 6 activities like bathing, like I told earlier, and each activity is scored 1 or 0 point based on the independence in doing the activities, whether the person require any supervision, any assistance in doing these activities or not. The 1 or 0 score points has been allocated. So total of 6 points was there in the scoring, and if a person score 6 points, he is said to be fully independent in all the 6 activities. And if the score is less than 4, then there is a significant dependence in most of the activities of the daily living. So the next will be the Lawton-Brody index of the IADL. So in the Lieutenant-Brody Index of IADL, let us learn how to perform it. So there are the 8 instrumental activities that includes the ability to use the telephone, the shopping, the food preparation, the housekeeping, laundry, mode of transportation, and responsibility for own medications and ability to handle finances. So each activity is called as independent and dependent, based on whether the person is able to do the activities or not. And the lower the index, the more the dependent the person is. So this is the Lieutenant-Brody Index of the IADL. As you can see, all the 8 instrumental activities. And in the scoring part, the maximum of 8 points will be there. And if a person score 8 points, he is said to be fully independent in all the IADLs. And if the score is less than 6, then there is a significant dependence in most of the activities of the person.
So, thank you, Dr. Chirag, for explaining that, we have 2 scales that we do. One is for the basic activities and the other is for activities, instrumental activities of daily living. And so we have assessed. Everybody, all the caregivers must assess. And after that, what is your role? So the role is that the most important role is that you have to identify who are the older persons at risk, who have got a lower score. So when you do, as I told you that you must do scanning and screening of all the elderly, you will be able to find out who are at risk. And those people who are at risk, you do need to seek medical advice and specialist care. You need to plan supportive care at home and encourage independence. And you also need to monitor regularly, because early action will slow down the functional decline. Okay, so very important to do this. Now, coming to the second section of ours, we have done the first part. So now we will be trying to discuss what are the common screening tools for assessment of cognitive decline. So cognitive decline basically measures if there is a gradual reduction in a person's ability to think, learn and remember. There are 2 terminologies. As I told you, what is cognitive? Cognitive is the ability to think, learn and remember. And all of you, as far as cognitive domain is concerned, the most common disease that you are having is dementia. So what is dementia? It is a severe and progressive condition where memory loss and confusion can make the daily activities difficult. So if you see this, one of the most common diseases is Alzheimer's, as you know. Now, what is the need for assessment of the cognitive decline? So the first and foremost is again that you should be able to identify the older persons early at risk, because this will have better health outcomes. It will also help you to plan for supporting the caregivers and plan for financial support and legal matters, because slowly with dementia, the older people start forgetting so many things. So when they start forgetting, for example, whether where is their checkbook, what is their name of their bank account, where have they kept the locker key, how much money are they going to invest. So many things they forget. So for this, a lot of support is required, and we need to plan all their financial activities and legal matters. So an early action can slow down the cognitive decline. As I told you, there are various types of cognitive decline that we have. The first and foremost is the normal aging. That is, all of you know that with age, nowadays even with ourselves it happens that we start forgetting so many things. For example, we forgot what we ate today. That is one of the commonest things. If somebody asks us, what did you eat for lunch today? We have to really think. Sometimes we also say, really don't remember. Similarly, when was your friend's birthday? Sometimes we don't remember. We need to see our diary. Similar thing happens with aging. So these are very small things which people tend to not remember, but at other times when you ask them, they may remember. So it is not a permanent thing. It is a temporary thing. It is a mild thing. Sometimes we have mild cognitive impairment. That is, they do forget things, but they are not such things which will affect their daily living. But sometimes you have severe memory and thinking problems which can affect their daily living. For example, you may completely forget every time, you switch off the gas. You don't remember whether you switched off the geyser or not. Where did you keep your keys? It is a permanent thing, you never remember. So, you keep forgetting. And sometimes when this becomes very progressive, it can lead to an inability to perform even simple tasks like even swallowing, even remembering your own, recognizing your own face in the mirror. It can become that bad. So these are the types in which cognitive decline can occur, and it is very important for us to be able to pick up whether there is a cognitive decline or not. So all older persons must also be screened for cognitive decline. So for being able to screen the cognitive decline, we do the mini mental state examination or MMSE, which tests for memory, attention and orientation. So this is another test which is performed, very simple, can be performed by all healthcare workers or by caregivers, and I will request Dr. Chirag to explain how this particular test is performed.
So let us learn how to perform the mini mental status examination, the test that is used to assess the cognition. So this MMSE scale has been divided into the 6 domains. Let's go with step by step. So the step 1 is the orientation domain. It consists of orientation to the date, that includes the current year, the knowledge of the current season, current date, day and the month, and the orientation to the place, that includes the state, the orientation to the country, the orientation to the city, the orientation to the name of the hospital or the building in which the person is residing, as well as the floor. The second one is the registration. In this, we name 3 distinct objects like apple, chair and coin, and ask the patient to repeat them. If the patient is able to repeat all the 3 objects, a total score of 3 points been allocated to the person. Then third domain is the attention domain, in which we ask the patient to serially subtract 7 from 100, like 100, 93, 86, 79 and similarly. Or we can also ask the patient to spell the spelling of the word, that is word backwards, that is DLROW. So a total of 5 points has been allocated in this. And the fourth domain is the recall part, in which we ask the patient to recall the same 3 objects that we register in the second step once again, and a total score of 3 points been allocated if the patient is able to recall all the 3 objects. The fifth one is the language domain. In the language domain, we ask the patient to name 2 common objects like wristwatch or pen. Then we ask the patient to repeat a sentence, and in the third step, we give a 3-step command to the patient, like take the paper in your right hand, fold it in between and then give it back to us. So if the patient is able to perform the 3-step command or not, the score has been allocated. Then we write a sentence instruction, ask the patient to read it and obey it, like close your eyes, we write on a paper and ask the patient to read and obey the instruction. The last one is to write a sentence, a complete sentence involving a noun, object as well as the verb. The patient had to write about himself or about anything. In the 6th domain, that is the visuospatial, we ask the patient to copy a pentagon figure. If the patient is correctly able to copy that figure, a score of 1 point has been allocated. And now you can see it is the total MMSE score. You can see all the 6 domains in the score: the attention, the registration, the recall, the attention part, the language, as well as the pentagon also you can see. A total score of 30 points is allocated to the patient if the patient performs all the test. And if a person scores 24 or more than 24 points, then the person is said to have normal cognition. And if a person's score is less than 24 points, then there is a cognitive impairment in the patient.
So thank you, Dr. Chirag, and I think this is a very important test and a very, very simple test which I think all older persons we can teach them, and we can assess them for this. So what is your role as a caregiver or as a healthcare worker? You should be able to, through this test, identify the older persons easily. You should also try to check if there are any treatable causes. For example, in infections, you can have some kind of fogging of the brain. You can have cognitive, like in COVID, you remember, so many people had fogging of the brain. Then you have B12 deficiency, which is a very simple, deficiency. It can be easily treated. Thyroid problems or depression. if all these problems are there, they are treatable, and once they are sorted out, the cognitive decline can be stopped and it improves. But you also require, because you cannot test for all these, but these, you must know that these can be the treatable causes. So if there is a cognitive decline, it is important that you explain to the family that it is possible that he may be having, or he may be suffering from some of the conditions which are treatable, and for this we can very easily improve their cognitive decline, which is also having an impact not only on his own quality of life but also on his interaction with his family and other caregivers. So it is important to stress upon them that you must show this older person to a treating physician or to a health care institution. You can help the family manage issues that may be happening with cognitive decline and explain to them how to work about with the older persons, so that they are like, if they are having some problems in remembering, there can be always somebody next to them. If they are cooking on their own, it is not good to leave them alone with the gas, and there should be somebody at least who is seeing with them. We can seek medical advice or intervention if required, and we must do the assessments regularly, because as we told you that in certain dementias and in Alzheimer's there is a progressive decline. So to be able to document that the decline is happening progressively and it is deteriorating, it is very important that you must do the assessments regularly and record them. So it is, you must understand that early action slows down cognitive decline. So I think we will like to stop here, and we will join you after another 1 or 2 minutes when we come to the second part of our video, of our teleconferencing, in which we will be sharing with you other assessments also. So you must understand, just to sum up a very little bit, we have done the assessment of the functional status, in which we did 2 tests. One was the Carl's test for the activities of daily living, and then we did the Lawton Brody test, which was for the activities of instrumental activities of daily living. And then we also taught you that cognitive decline is a very, very important component which must be screened for in all older patients, and we can do the mini mental health examination as a screening test, and if it comes positive, then it is very important you as a healthcare provider, health worker or a health caregiver to contact into a healthcare institution. So, Dr. Chirag, would you like to say something else in this regard before we close this part?
Yes, ma'am. Actually, we are doing this exercise of assessing the intrinsic capacity of the older adults. It's a very important, because as the WHO also stresses upon it, the intrinsic capacity is the capacity of the net capacity, the physical and the mental capacities of an older adults. And if we try to screen them, that is, try to identify them early, then there is a quite possibility that we might correct them, even restore them, and prevent the major disability or impairment happening in the older adults later in the future. So it's very important, because the aging is happening, but we can try to make the aging healthy actually, and prevent major complications that are associated with the older adults. That can also further prevent the distress among the family members, the economic burden, the financial burdens also among the family members.
Yes, thank you so much. Thank you. Thank you very much, everybody. Thank you.
Do you wish to be part of a television studio like this, or any other media system? Or already part of any media system, want to enhance a new set of skills? Welcome to School of Journalism and New Media Studies. Here in the School of Journalism and New Media Studies, we are offering program for all set of people to learn and enhance their media skills. The vision of School of Journalism and New Media Studies is to generate a new set of professionals in the area of media and communication studies with understanding about role of media in the national development and global understanding. We offer innovative programs in the field of journalism and mass communication that sets the benchmark of high quality learning and teaching process at the national level. We offer these programs across the country with the help of our regional network as well as study center. Same manner, many of our programs are offered through online mode with a sophisticated learning management system. SOHS offers programs from PhD in Journalism and Mass Communication till certificate level. We have Masters in Journalism and Mass Communication. The eligibility is bachelor's degree, and we are introducing this program in 3 languages: Hindi, Tamil and English. Students from national and international students can join either through online mode as well as in the distance mode. We have 4 postgraduate diploma programs, specialized areas in the field of development communication, digital media, electronic media and journalism and mass communication program. And all these 4 programs are available in distance mode. 2 programs are available in online mode, development communication and digital media. And we have specialized certificate program in community radio. IGNOU employs various media and communication tools for better teaching and learning process. School of Journalism and New Media Studies utilizes this media system for delivering all our programs. Come and join with us for exploring a new career and enhance your media skills.
Are you a fresh graduate? Do you want to fulfill your educational aspiration by pursuing higher education in various interdisciplinary and multidisciplinary areas like environmental science, environment and occupational health, philosophy, sustainability science, folklore and culture studies? If yes, the School of Interdisciplinary and Transdisciplinary Studies offers various programs like Master's Program, Graduate Program, Postgraduate Diploma, Certificate and Appreciation Program. The school offers 5 Master's Program. Master of Science, Environmental Science. The eligibility criteria for MSc Environmental Science is Graduate in Science, BTech, BE, Agriculture Graduate, Forestry Graduate and Veterinary Graduate. School also offers Masters in Environment and Occupational Health, Masters in Sustainability Science, Masters in Philosophy and Masters in Folklore and Culture Studies. The eligibility criteria for these 4 Masters program is graduate in any discipline. School also offers various socially relevant and need-based PG Diploma program like PG Diploma in Sustainability Science, PG Diploma in Environment and Occupational Health, PG Diploma in Folklore and Culture Studies and PG Diploma in Migration and Diaspora Studies. The school also offers PG Certificate in Climate Change and Avshist Prabandhan mein Praman Patra. The school also offers 2 doctoral programs, PhD in Environmental Science and PhD in Interdisciplinary and Transdisciplinary Studies. The school offers various innovative technologies and multimedia for providing a very excellent student support system. The study material is of high quality. The learner support is provided through Gyan Darshan, Gyan Vani, IRC, Swayam Prabha and Swayam channel of IGNOU. For more detail, please log in to IGNOU website. For online admission in these programs, visit school site and also the Samarth online education portal of IGNOU. So please join these programs and fulfill your educational aspirations. Welcome. So we are today learning how to do assessment of decline in intrinsic capacity of older persons. And as we discussed that we have got 7 main areas in which we will be doing the assessment of the intrinsic capacity. And now we have just now discussed how to do the assessment of the decline in the cognitive domain of an older persons. For this, we have to carry out a mini mental state examination. So let us see how a mini mental state examination is done. Dr. Chirag will help us with this. We also have Mr. Thapa, who is our elderly, an older person here, and we will try to do the cognitive decline assessment through the mini mental state examination. So Dr. Chirag, could you just demonstrate how to do this test?
Yes, ma'am. So, बाबा जी, अभी हम आपकी याददाश्त के लिए एक जांच करेंगे. तो हम आपसे कुछ सवाल जवाब पूछेंगे, आपको उनका जवाब देना है. ठीक है? आपको कोई तकलीफ तो नहीं हो? ठीक. तो शुरुआत करते हैं. अभी आप बताइए कि आज क्या तारीख है?
आज तो सोमवार है.
सोमवार है. तारीख कौन सी है? डेट कौन सी है?
अच्छा, डेट 19 तारीख है.
19 तारीख है. महीना कौन सा है?
महीना जनवरी है.
मौसम
ठंडी का है.
ठंडी का. साल कौन सा चल रहा है अभी?
साल जनवरी चल रहा.
नहीं, 2021 2026 चल रहा है. ठीक है. अभी आप कौन से देश में हो?
मैं इंडिया में हूँ.
इंडिया में. कौन सा राज्य है? स्टेट कौन सा है?
दिल्ली है.
दिल्ली है. शहर
ये इग्नू में मैदानगढ़ी में है.
ठीक है. और अभी कौन से फ्लोर पे हो आप?
अब सेकंड फ्लोर पे.
सेकंड फ्लोर में. ठीक है. तो अभी मैं आपको 3 शब्द बोलूंगा. आपको मेरे पीछे वो सुन के बताने हैं मेरे कौन से 3 शब्द बोले.
ठीक है जी.
तो सेब, कुर्सी, सिक्का. बताओ मैंने क्या बोला?
सेब, कुर्सी, सिक्का.
हाँ, बहुत सही. अब आपको क्या करना है? 20 में से लगातार 5 बार 3 घटाना है. तो शुरू करिए.
हाँ जी.
घटाइए. 20 में से 3 गए.
20 में से 3 घटाने तो 17. 17 में से 3 गए तो 14. 14 में से 3 गए तो 8.
14 में से 3 गए तो
14 में से 3 गए तो 9.
चलो, उसमें से 3 गए तो?
उसमें से 3 गए तो 7.
और आगे उसमें से गए तो?
7 में से 3 गए तो 4.
ठीक है. अच्छा
कोई
कर रहे हैं.
ठीक. 7. अभी मैंने आपको 3 शब्द बोले थे.
हाँ जी.
बताइए वो कौन से थे?
सिक्का, और आम, और सेब कुछ ऐसे बोला था.
ठीक है. आप और ये बताइए कि आप ये बताइए ये क्या चीज है?
ये पेन है.
ये पेन है. और वहाँ पीछे क्या लगा हुआ है?
ये घड़ी है. इधर
ये घड़ी है. ठीक है. अभी आपको मेरे पीछे कुछ वाक्य दोहराना है. ठीक है. बोलिए. हर चमकती चीज सोना नहीं होती. हर चमकती चीज सोना नहीं होती.
अच्छा, हर चमकती सी चमक नहीं होती है.
नहीं, मैं जो बोल रहा हूँ वैसा का वैसा ही बोलना है. हर चमकती चीज सोना नहीं होती.
हर चमकती चीज सोना नहीं होती है.
ठीक है. अभी आपको मैं कुछ काम करने को बोलूंगा. आपको वैसा का वैसा करके दिखाना है.
ठीक है.
ये कागज आपको अपने दाएं हाथ में लेना है. इसको बीच में से मोड़ के मुझे वापस देना है.
ठीक है जी.
ये लीजिए. ठीक है. अभी मैंने यहाँ पे कुछ लिखा है. उसको पढ़ करके और जैसे जो लिखा है वो करके दिखाइए.
अच्छा, पढ़ना है.
हाँ, पढ़िए.
आंख बंद करो.
ठीक है, बहुत बढ़िया. मुझे वापस दे दो. अभी आपको अपने कोई भी एक वाक्य लिखना है.
जी.
लिखिए. बोल के बता दीजिए क्या लिखा है.
मैं शाम को खाना खाता हूँ.
ठीक है, वापिस दे दो.
जी.
अभी आपको मैंने ना यहाँ पे एक आकृति बना रखी है।
हाँ जी।
ये ऐसे की ऐसी आकृति आपको नीचे बनानी है, बनाइए।
अच्छा, जी जी।
So maybe everybody can see how it has been made by the older person. So any pentagon kind of a shape can be given, and that has to be then repeated by the older person. थोड़ा mic से उधर करना पड़ेगा. Yeah, that's better. So to some extent it has been copied correctly. Okay. So how much score would you give him now, Chirag?
The patient has score of 9 plus.
So we have the mini mental state examination. I think we can display till then through our form, which can be displayed. And this is what Dr. Chirag is calculating. Can we have the form displayed?
Score of 25 points would be there.
Yeah. Can we display the form, please? Yes. This is the. So you can just explain how you came to that.
So in the orientation part, patient has only one error. The floor he had named incorrectly. So a score of 9 points been allocated to the patient. The registration had full score of 3 points being given. In the attention part, in the subtraction, serial subtraction of 3 from the 20, a score of 3 points been given out of the 5, because patient had done 2 subtractions wrongly. In the recall also, patient had been given 2 points only, because patient is able to recall only 2 objects and not all the 3 objects. In the language part, patient had correctly named the 2 objects, repeat the sentence also, follow the 3-step command, read and obey the instruction, as well as they write a sentence. So full score of 8 points been given. And in the visual spatial, because the pentagon was not made correctly, so score of 0 points been given in that, and that's how a total score of 25 points is the score of the patient.
But still he is under the normal cognition.
Yes, because the score is more than 24, it's under the normal cognition.
बहुत अच्छा किया आपने एग्जाम में.
ठीक है.
अच्छा किया. Okay, so this is how I think it was a good example of how we have been able to actually, do the this thing. So now let us come to, we will do the second, 1 second. One second. Okay, so we are coming to the mobility, assessment of the mobility now, locomotor system. Now, what are the common causes of the mobility problems? The common problems of mobility problems is muscle weakness, joint stiffness, balance problems, nervous system disorders, cognitive issues and frailty issues. I'm sorry, I'll just put it in the, sorry. So you can see that we have common causes of mobility problems, that is muscle weakness, joint stiffness, balance problems, nervous system disorders, cognitive issues and frailty issues. So what is the need? Why do we need to discuss the locomotor capability? Because there can be difficulty in walking or standing, which increases the risks of falls. And the older persons may also have a fear of falling, so they will not walk, they will not do much movement, and so there is a loss of independence. They even would not want to go alone or without assistance to the toilet. They may not want to go for a walk in the park. They may not want to go visiting anybody. So there is a reduction in the independence. It also reduces the mobility, and this can lead to depression. Reduced mobility can also limit access to the healthcare, and a prolonged immobilization can lead to problems like pressure sores. So you can see that an early action will help in reducing the problems associated with the mobility. It is very important to screen all the older adults for a decline in the locomotor capability. And how do we test this? The most important and the simplest test for testing for a locomotor capability is timed up and go test, or called a TUG test. So this will test the mobility, the balance, gait and the risk of falls in an older person's. So we have with us Dr. Chirag, and Dr. Chirag, can you first explain how you will do this test, and then maybe we can also demonstrate. We have Thapaji over here, and you can demonstrate how to do this test so that our caregivers can understand it better.
So let us learn how to perform the time up and go test, that is the TUG test, which help us to assess the mobility as well as the balance as well as the risk of falls in an older person. So before we begin, we need a chair with the armrest with a standing height of 45 centimeter, a stopwatch or a timer to record the time, and a clear walking path of around 3 meters. And we must ensure safe surroundings around the patient in order to prevent any injury during the test. So how to perform the test? We first make the patient sit comfortably back against the chair, and we ask the person whether if he is comfortable and able to walk 3 meters or not. We mark a 3 meter line from the chair, preferably a red one as depicted in the picture here, and we give clear instruction to the patient that he has to stand up, walk up to the line, turn, come back and again sit down. And during this, if the patient feel any dizziness or any imbalance, he may ask us for our assistance. We ask the patient to walk on his usual pace only, as he used to walk at his home or in his neighborhood. We start the time when the patient stand up and stop the time when the patient sit down fully, and we record the time in the seconds.
So this is very important. I think all of you must have understood how the test has to be performed. One thing of caution, very, very important, please remember, you must ask the older persons, and if you have the family, that there is no instability in walking, or the person is able to walk, is confident in walking, because if he is not, and he may fall down. So you may also always offer help. You may ask them if they are not confident, you can be by their side, or you can offer them some kind of a walking aid, maybe a stick or a walker or something just nearby, so that if they feel unstable, they can get hold of it. So it is very important that it should not happen that during the test itself you jeopardize the health of the person, the chances of injuries. So I think I will request now Dr. Chirag can demonstrate. थापा जी, आपको एक और टेस्ट करेंगे हम. डॉक्टर साहब आपको पूछेंगे और बताएंगे, ठीक है?
तो नमस्कार जी. अभी हम आपका एक चलने की शक्ति का एक बार एक जांच करेंगे. अभी आप चलने के लिए समर्थ हैं? अगर आपको बीच में कुछ भी ऐसा लगता है कि मुझे चक्कर आ रहा है या मेरे को गिरना जैसा लग रहा है, तो हम हमें बता सकते हैं, हम आपको पकड़ लेंगे. नहीं, ठीक है. तो आपको अभी क्या करना रहेगा, आपको सामने मैंने एक मार्क कर रखा है, वहां तक चलना है, उठना है, चलना है, घूम करके वापिस आकर के बैठ जाना है. जब मैं बोलूंगा शुरू करना है तब आपको शुरू करना है, ठीक है? जैसे आप घर पे चलते हैं उतनी ही रफ्तार से आपको चलना है. ठीक है, आप समझ गए हैं बात?
समझ गए.
ठीक है, तो शुरू करिए.
ठीक है.
ठीक है, धन्यवाद. So the patient, the Thapaji, took 9.5 seconds to actually do this test. So what does this time mean actually? So if the time the patient took to complete the tuck test is more than or equal to 12 seconds, then it indicates that there is an increased risk of fall in the elderly.
So that means he does not have a risk of falls. So we can explain to him. तो आप बहुत अच्छा चले और ऐसे कोई डर नहीं है कि आप गिर जाएंगे, तो आप आराम से कहीं भी जा सकते हैं बिना किसी मदद के. So what is your role? You have done assessment of the locomotor decline in an elderly, and you have come to the conclusion that whether he is at high risk or he is not at high risk. So it is very important that you identify the older persons who are at risk. You need to check for any treatable causes. For example, there may be pain, he may be having acute pain, or he may be suffering from chronic pain, which could be because of arthritis, which could be because of any other problems, a nerve pain or something. Whether his vision is okay or not. Sometimes, the locomotion or mobility may be hindered because of poor vision. Sometimes the footwear may not be comfortable, and sometimes because of certain medicines he may be suffering from vertigo or may have some other kind of dizziness, because of which he may not be very comfortable in walking. Now, if you find that the older person is at a high risk of falling, it is very important that you educate the family members on fall prevention. So how they should take care, they should be not allowing him to, walk without particular aid, and there should be somebody, aware about his whereabouts or around him when he is making some kind of movement for any purpose. Then you may need to also seek medical advice and intervention if needed. You may require him to be further assessed to find out the causes of why he is having locomotor problems. And you also need to monitor regularly, because this may again be a progressive thing, and what is the reason for it being progressive is also required to be documented. So an early action of yours will help in reducing the falls. So I think another very important thing that we need to do with the locomotor and the mobility issues of an older person is the home safety assessment. So what do you mean by home safety assessment? Home safety assessment means that you need to spot the hazards, and you may suggest to the family members or other caregivers how to fix them. Okay. So what is the need for home safety assessment? Because the living environment can affect mobility and safety. Unsafe homes can increase the fall risk. And what are unsafe homes? Unsafe homes could be, for example, if the floor is uneven, if you have different levels, because nowadays there are so many, builder flats being built. People like to have aesthetically good looking homes, but in the process sometimes they may not be very congenial for the older persons. So to make the living environment look a little bigger, sometimes people do have, different levels for the different rooms, and this can be a very big hindrance or an obstacle for smooth mobility of an elderly. So simple changes that you may suggest, this, of course architectural changes will not be possible, but sometimes adding a non-slip tread tiles in the house, keeping the house very clean, free from clutter, all these can be simple changes that can help improve the independence. The changes can also reduce the chances of injuries. So early action will help in home safety. So how can you do the home safety assessment? I think Dr. Chirag, if you would like to explain how an geriatric care provider can do assessment of a home safety, that will be, please tell us.
Yes. So first we need to support the hazards and fix the risk. We need to assess all the areas of the house, be it the entrance, be it the stairs, be it the kitchen part, be it the living room or the bathroom or the washroom part. So we need to assess all the areas of the house, identify the hazards and fix the risk. So let us learn how to perform it. So starting with the entrance as well as the pathways part. So the common hazard in the entrance part like involve uneven steps, poor lighting at the steps, slippery floors or cutlers or obstacles. And the simple fixes like even or non-slip pathways, a good entrance lighting, remove the clutter like any loose rugs, any loose carpets, welcome carpets or something. And also we need to install handrails on the steps as depicted in the picture, so that the older person can grab them while climbing up the stairs. So
and good lighting, as you said, is very important, but glare in the lighting is not at all important. Good lighting should be diffuse and it should not be hurting to the eyes. Otherwise, because of their vision problems, they may have a face-up problem.
Yes.
Okay, so let us go to the next room now.
So let's begin, come to the living rooms as well as the bedrooms. In the living rooms, there could be loose rugs, again like loose carpets, or again the poor light timing, night lightings, like when the patient wake up in the night for the washrooms or for drinking water. If the light was poor, then there will be high risk that patient may trip over some objects and fall down. There also, if there are loose electrical cords on the floor, like electric cords of the table fan, electric cords of the cooler, then they can also serve as an obstacle and may lead to the fall of an older adult. And if there are low height or unstable furnitures, that can also cause falls to the patient. So the simple fix is like remove any unsecure rugs, any loose carpets, we should remove them, or we should stick them to the floor. We should use night lamps, so that if the person wake up in the night for drinking water, for going to the washroom, then it will be comfortable for them to do that. We also need to keep these electrical cords sidewise or fix them to the wall, so that they don't come in the walking area of the patient and they do not fall down to the ground. And we also need to make the this furniture, the table and the as well as the chair height stable, so that there will be no difficulty in sitting as well as rising up from the chair or the table.
I think in that diagram you did have some 1, 2, 3 marked. So I'm not very sure, but I can try. I think the first one is unsecured rug, probably maybe yes, for an animal or maybe for somebody to sit down. The second one I think is the cord which is not really wound up, and I think the third is the knitting, which is also very carelessly put in the, maybe somebody just moved very fast and left the knitting there. So okay, so these are 3 things which should have been taken care of, especially when there are elderly at home. Now I think you can talk about something of the bathroom and toilet, because yes, these are areas which have got maximum number of accidents which happen, especially in the case of elderly, and we get the fractured neck, femur and other fractures very easily, back also sometimes when they do fall. So how to secure the bathrooms and the toilets?
Yes. So the common hazards in the bathroom and toilets, like slippery floors, the wet floors, or like in most of the homes, there will be no grab bars. So if the patient feels unstable, he might not able to hold on to something. And also there will be low toilet seat in most of the bathrooms.
I think we can display the slide which is showing. Yes, thank you.
Yes.
Yeah.
So the low toilet seats, like patient might feel uncomfortable while sitting to those toilet seats, as well as difficulty in rising up also, and there will be again the poor lighting in the washrooms with the glare also could be one of the common hazards. So the simple fix is like we need to place non-slip mats in the bathroom, so and we need to keep the floor dry, and also install some grab bars, especially near the toilets as well as near the shower. So like depicted in the picture, the elderly is holding on to onto the grab bars, and the grab bars are also installed along the corners of the bathroom. So these are the near the toilet as well as near the shower, as you have already told, these are the maximum areas of the fall. So and also we need to raise the toilet seat to an approximately 50 centimeter height, so that person feel comfortable while sitting on these toilet seats, as well as rising up also. And there should be also proper lighting, so that the person don't feel like dark or something, and do not trip on unusual objects. The next one will be the kitchen as well as the stair part. So even in the kitchen there could be like we keep some items way too high, some even the items that we used to use very commonly, like sugars, tea leaves or salt, that could be a hazard. And in the kitchen also there will be slippery tiles and poor lighting could be there. So the simple fixes include we need to install those tiles which are non-slippery, or install some carpets which are non-slippery and fixed to the floors. We need to keep the daily items like sugar, tea leaves, salt upon the reach of the elderly, and we also need to have a proper lighting of the kitchen. In the stair hazards also, again in the entrance part, we need to have the handrails, we need to have the even length of the stairs, and we need to make sure that the edge of the stairs will be also round, so that they won't cause any major sharp injury to the person even if he falls. And also the stairs should be non-slippery, and they should not be like shiny and slippery or wet stairs. They should be made either of the stone that is non-slippery, or we install some carpet fixed to the stairs which provide a non-slippery base to the stairs.
Okay, so I think you have displayed this particular image for us to be able to identify that what could be the problems in which they can. So I will try to identify. I'm not sure if I'll be able to identify all. I think one thing is probably that you are showing that there is water. Probably I think this is water, and so that is the most dangerous thing for an older person to be having in its path of movement. Then of course we have a very bright glaring light which is coming. We are having a sharp object which he could injure himself with. We are again having cords which he could entangle because his vision may not be very good, so he may not be able to see these cords. And of course we have these rugs or some wet towels on the ground which may hinder him. I'm not very sure if I have this thing. Maybe you can help us and tell if we've been able to catch everything. I think one or two things I have not caught.
Yes,
so
sir.
can you please explain again?
Yes,
Yeah.
ma'am. Most of the items you have caught correctly, and this is a picture of a living room which might we all have in our homes. As we can see, the glare light that ma'am has correctly pointed out is causing some photophobia also to the patient, and even because of the glare also patient vision might be impaired and he might fall. The water on the floor is also there, as well as the tile of the floors. They might seem to be very shiny and beautiful, but they are also slippery and could cause a major fall in the elderly. The pointed object, that is the scissor, it is even kept open as well as keep on the floor, so it can cause injury, the sharp injury to the patient foot. The loose cords of the electrical, maybe some table fan or cooler is lying there, so it can also trip. The patient can also trip by these cords, as well as the loose cloth, the loose carpets with the folded eyes. They are being just lying around the floor, so they can also make the patient fall actually, and can even when the person step on these loose rugs, they might actually fall or slip their foot on them. And also in the picture, as we can see, there is a low lying stool lying just beside the older person. So these heights are not suitable because the person not even able to visualize them, and also if the person wants to sit on them, there will be difficulty in the sitting because the knees are too much in the flexion posture, too much bent, so they will cause the pain to the knee joint to the person, as well as when they try to get up, that will be also difficult, and so much difficult that the person might fall while rising from these. So these low suitable stools or chairs we should avoid in our living rooms.
So I think a lot of important information you have given as far as assessment of the home safety is concerned, which all our caregivers and healthcare workers should be able to identify and should be able to advise the family or the other informal caregivers about how to deal with it. So we don't have to really invest a lot of money, but we can just also give simple tips, like you said, that we can reduce the clutter. Simple things like picking up sharp objects, removing things which are on the way, the towels or the rugs which are not fixed. And for those who are actually not having very stable or very sure of their walking, we can always offer assisted devices which can be in the form of walking sticks or in the form of walkers or in the form of aids which can help them move about. We also must ensure that they have proper footwear so that they don't get chances of falling, and we must always reassure the older adults, because if the older adults are unsure of whether they are confident in walking or not, then they will lose their independence. So for them to remain independent, they should be now with an assistive device, or after the assessment we can reassure them again and again that there is no possibility or very less possibility of their actually falling or injuring themselves. So this is something I think which is very, very important. So I think that's all that we have for this assessment and for this part. I think we can have a very short break again, and in this we had a very beautiful demonstration of how to do the mini mental health examination. We also saw how locomotor capability can be assessed, and with the timed up and get up and go test, and we also saw how we can do the assessment of the home for safety of the older persons. So would you like to also contribute in saying something?
Yes, ma'am. So as we see in these domains, like we assess the mental capacity of the person as well as the physical capacity of the person. So in the mental capacity, we screen using a simple tools which like recalling the objects, serial subtraction. So these domains, even if the person might feel that he is not able to, he is not intellectually impaired, his memory is sharp, we can still need to screen all the older adults. And if the score is less, we must refer them earliest to the medical care. That can prevent again the further decline in the cognitive impairment, as well as it can also help to identify the reversible causes that can be easily corrected, and the memory might be preserved or early treated in these older adults. Also the physical capacity, as we can see, like this is a very simple test. Just we need a simple chair and a clear 3-meter walking, and we need to just record the time how much patient need to cover this distance. And these simple tests tell us so much about the physical capacity, about the mental capacity. And just by recording the time, we can identify which older persons are prone to have these disabilities in the physical or the mental domains, and we can refer early them to the specialist care in order to prevent major disability. Also the environmental hazards that we talk, like these are the simple fixes that we must do, everyone must do in their homes. Even for the normal person of normal age, these can be hazardous, they can also lead to falls. But for the older adults, they can be even more and more disability causing, like they can cause hip fractures, fracture of the vertebrae that can further deteriorate their health.
Thank you so much, Dr. Chirag. Thank you. We will meet again after 2-3 minutes for the part 3 of the presentations. Thank you.
Indira Gandhi National Open University, accredited with A++ grade by NAC, provides you a quality education in open and distance learning. School of Performing and Visual Art is offering a wide range of programs in performing and visual art. Certificate program in painting, certificate program in applied art, certificate program in Bharatanatyam dance, certificate program in Hindustani music, Carnatic music and theatre arts.
बहुत यत्न करने के बाद भी नहीं पा सका, संजोग से मैं इस बार लेके आया हूँ.
All the certificate programs are of 6 months duration with 16 credits. We offer 1-year diploma in theatre arts with 10+2 eligibility criteria of 32 credits. The learners are exposed to various aspects of elements of drama, theatre games, acting techniques, scene work procedures, and they will also have the opportunity to take part in a classroom play production. We also offer bachelor's degree in Hindustani music. This program is duration of 3 years, and learners are having the flexibility to complete this program over a period of 6 years. Apart from bachelor's, we also offer masters in drawing and painting with a duration of 2 years. Apart from certificate programs, degree, masters, we also offer PhD programs in performing and visual art with a specialization of visual arts, music, dance and theatre. Art is the perfect manifestation of every human being. So what you are waiting for? For online admissions, please visit our website www.ignou.ac.in. For more details, you can also contact Director, School of Performing and Visual Art, Block number 15G, IGNOU, Maidan Gadi, New Delhi. You can also reach us at sopva@ignou.ac.in. Happy learning.
आश्रम के चूहे पकड़े, तुम तो सचमुच राजा लगने लगे।
पता नहीं ये राजयोग कब तक रहेगा।
तो हमारी माया के लिए सुरक्षित है।
Dear learners, welcome to IGNOU. You are going to lead with a difference. So how do you lead with the difference? The unique attributes of the university system through which you're going to go for the management program or any other program is the multiple entry and exit. It provides flexible learning where a learner can learn at its own will and at its own pace. It offers multimodal approaches like we have MBA, the normal through the distance learning mode and through online mode. So it has a multimodal approach. It has face-to-face counseling. It offers web counseling also. It gives interactive satellite-aided communication network through teleconferencing, and it also gives the radio counseling also. When we talk about School of Management Studies, it was the first school and it had the pioneer program of diploma in management. Till date, it has been offering around 14 programs in management and 13 programs in commerce disciplines. The school has international presence as well as it provides the programs in specific Asian and African countries across the globe. Now talking about Master of Business Administration. What are the objectives? What are the learning objectives of this Master of Business Administration? What are the unique features of this Master of Business Administration which IGNOU is offering? Let us see the program at a glance. The program name is MBA and the eligibility criteria for this program is bachelor's degree, minimum of 3 years duration with at least 50% marks and 45% marks in case of the reserved category. The duration of the program is minimum 2 years and maximum 4 years, and the program fee per semester is 15,500. The total credits of the program, the total credits are 116 because there is one project course which is equivalent to 2 courses. So it comes out to be 29 courses. If a student wants to exit the program after completion of the specified courses available in the first and second semesters, that is 56 credits if the student completes, then there is an exit option available. The award of postgraduate diploma in management on the request of the student if the student wants to exit. Apart from this, there are 4 stand-alone PG diplomas also which are a different part. They don't fall a part of the management program. They are the stand-alone diplomas. That is postgraduate diploma in human resource management, postgraduate diploma in financial management, postgraduate diploma in
Welcome. So we have been learning about how to do assessment of older persons for the intrinsic capacity, and the various tests that we are doing is for test of which we have already done is test of the functional status. We have done test for their cognitive decline and for their locomotor capability. Now we are coming to the new assessments, and we have with us Dr. Chirag, who is a geriatrician from AIIMS Delhi. Welcome, Dr. Chirag. And we will now be dealing with common screening tools for assessment of malnutrition. So basically all elder people can be malnourished or are at a risk of getting malnourished, and so we do this simple test to identify if they are at a risk of malnutrition. Now what is the need for this? Because as I told you that malnutrition can in elderly go unnoticed, and it is a preventable and treatable condition. There can be memory problems. There can be slow healings of wounds or ulcers. It can also present as tiredness and frequent infections. It can present as increased risk of falls, and it can also have low mood and irritability. So this is something which is possible. And what are the common causes of malnutrition? Common causes of malnutrition is poor appetite, chewing or swallowing problems, problems with digestion, mental health issues, which can be depression, or it could be because of side effects of medicines in which you don't feel hungry, or as it is, sometimes you may lose some important nutrients from your body, and so is the case in case of certain diseases. There can be social factors. For example, the elderly are not able to purchase, maybe because of financial constraints, or maybe because the market is too far, or they are not mobile enough to go and purchase. Nobody else can get for them. Or it can be because they are not able to shop or even cook. So these are the reasons which can cause malnutrition in an older persons. So it is important to screen all the older persons whether they are suffering from a risk of malnutrition. And the simplest and the most commonly used test is the mini nutritional assessment, in which it tests if a person is going to be having a possibility of getting malnourished. So Dr. Chirag, I will request you that you can explain how to do this mini nutritional assessment to our caregivers.
So let us learn how to do the mini nutritional assessment, that is the MNA tool to screen for the malnutrition in the older adults. So it is a comprehensive tool, consists of around 18 items, and a total score of 30 points been allocated to the person. So it can be used in all the older adults, and it basically consists of 4 domains. The 4 domains like anthropometric assessment, general health assessment, dietary assessment, and subjective self-assessment. So starting from this is the picture of the MNA tool, as you can see, and total of 30 points is been there, and with which mostly divided into basically divided into 4 domains: the anthropometric, the general health assessment, the self, as well as the nutritional domains. So let's learn the domain one by one. So starting with the domain 1, that is the anthropometric assessment, the BMI of the patient, that is the weight divided by height ratio, is being measured. As well as we ask the patient whether there is any history of recent weight loss and how much it is. The mid-arm circumference as well as the calf circumference will be measured under this domain. The domain 2, that is the general health assessment. The questions include like whether the patient live independently or not, whether he is dependent on someone or not, whether the patient is on any multiple medications like 5 or more drugs, whether the patient has suffered from any recent illness or stress, has been recently hospitalized or not, whether the patient had any difficulty in his mobilization or gait problems, or whether the patient is suffering from depression or dementia. The third domain, that is the dietary assessment domain, we ask the patient the number of meals he is having per day, 3 times, 4 times, and how frequently he is eating. What is the protein intake of the patient, whether he is taking any protein sources like soya bean or meat, fish, eggs, or any dairy products like milk, curd or yogurt he is consuming or not, whether there is any intake of fruits and vegetables in his daily diet, whether the patient, what is the patient daily fluid intake, how much water or clear liquids he used to drink per day, and whether he is able to feed himself or not, or whether he require any assistance to feed him from his family members or any caregivers. In the domain 4, that is a subjective self-assessment, we ask the patient to rate his nutrition out of some numbers, and also we ask the patient to rate how he feels his health is as compared to other older adults of his own age. So these are the 4 domains, and this is again the MNA scale, and how it looks, and it covers all these domains, and the total score of 30 was the score. If any person score 24 or more, then the patient is said to have normal nutrition. But if the score is less than 24, then the patient is said to have at risk of malnutrition. Or if the score is less than 17, then the older person might be malnourished.
Okay, so I think this is very clear, and of course the form was not very clear, but this is a very easily available form and is also available with all the students who have enrolled with our program, so they can easily access this form. And what is your role? That is most important, that as a caregiver or a health worker, when the assessment is being done for malnutrition, so you're required to identify the older persons at risk, check for the treatable causes, like the teeth problems, swallowing problems, mood or medicines, because these are the problems that can result in malnutrition, but they are to a large extent treatable. And you must suggest small, frequent and nutritious meals. You may need to refer to a nutritionist or a dietitian in case you find that the person is falling into the category of either at risk malnutrition or is already under malnutrition. You may need to consider suggesting for nutrition supplements, but again these suggestions should only come after being endorsed or being concurred with a clinical specialist, a doctor or a nutritionist or a dietitian. And it is very important that you weigh or monitor the weight regularly, because weight is one thing which changes the earliest and is a very early indication that the patient may be going into malnutrition. So now we come to the second test, and this is the screening tool for assessment of visual impairment. So visual impairment checking is very important, because we all know that with the changing and increasing age, the elderly may have visual problems. But what is meant by visual impairment? Visual impairment means that the person's vision is significantly reduced and cannot be corrected with regular glasses or contact lenses. So what is the need for visual impairment? Because somebody may say that, this is a normal aging process, everybody will have visual, some kind of visual impairment or some kind of visual loss, so what is the big deal? But then yes, it is important, because in some cases which are treatable, the undetected conditions can lead to further vision loss if they are not managed. Management and assessment and then further management can help in improving the quality of life. Everyday task, we must need to find out whether like reading, cooking, driving is becoming difficult or not, whether there is any increase of chances of falls because of visual, as we discussed during locomotor also, and there are increased chances of depression and social isolation, because you are not able to read properly, you are not able to move because of your vision problems, so naturally you have your social activities restricted, you go in for isolation, and which ultimately goes into depression. And it also increases your dependence on other persons, because there are so many things which you cannot do. For example, if you were very good at sewing or very good at stitching earlier, but now you are not able to see, you are not able to put a needle in the thread, so it increases your dependence and it also increases the poor quality of life. What are the common causes of visual impairment? One of the common causes in this age is, of course, the commonest is cataract. Sometimes you may have glaucoma. Fresh myopia is an increase in the visual impairment due to a loss of your muscle, muscle mass in the working of the muscle in the eyes, and diabetic retinopathy of people who have been having diabetes since a long time can also result. To some people also macular degeneration. Macular degeneration is basically, you all may have heard of retina. Retina is the part of the eye through which you are able to see. So macula is the part of the retina which is important for vision. Sometimes this may with aging degenerate, and more in some individuals than others, and cause visual impairment. So it is very important to screen all the older adults for visual impairment. So the most common, all of you, because you may have taken your older persons or somebody in your family for an eye checkup, you must have seen how a Slennon chart is used for screening of visual impairment, which will test whether there is an impairment or not. So I will request Dr. Chirag to explain how this Slennon chart is used for testing of visual impairment.
So let us learn how to use the Snell's chart for testing of distant vision in an older person. So first we need to prepare for the environment, like we need a well-lit room with no glare, and the chart should be stick on the wall, and the chart height should be at the eye level as depicted in the picture here. The distance between the chart and the patient should be approximately 6 meters or 20 feet, and we need to the person is allowed to wear his usual spectacles if he used any for the distant vision, and we have to explain clearly and very simply to the patient that he has to read the letters from top to bottom. So how to perform the Snell's chart? We ask the patient to cover one eye, but do not press too hard on that eye. We ask the person to read the letters from top to bottom and encourage reading the smallest line possible. Record the smallest line, the patient read correctly, the number is written on the Snell's chart, we need to record that number, and we need to repeat the same procedure with the other eye also. We need to check one eye at one time and both the eyes separately. So here is a demonstration video on visual assessment using the Snell's chart.
नमस्कार सर जी, अभी आपकी आंखों की जांच करेंगे। अच्छा। तो आप अंग्रेजी के अल्फाबेट पढ़ने में समर्थ हैं? हाँ, समर्थ हैं। ठीक है, आपको क्या करना है, अपनी एक आंख एक बारी में बंद करनी है हाथ से, और ऊपर से लेके नीचे तक अक्षर पढ़ने हैं जहां तक आप पढ़ पाओ, और जब नहीं पढ़ पाएंगे तो फिर हम दूसरी आंख के लिए भी सेम ऐसे ही टेस्ट करेंगे। अभी आप अपनी एक आंख बंद कर लो और ऊपर से नीचे तक अक्षर पढ़िए। ओ, हाँ जी, E-C, हाँ जी, नीचे वाला ठीक है। अभी आप दूसरी आंख बंद कर लीजिए, दूसरी आंख बंद कर लीजिए। अब
ये नहीं समझ में आ रहा, C-D, और नीचे वाला थोड़ा थोड़ा दिख रहा है।
पढ़ पा रहे
नीचे वाला जैसे एक पढ़ रहा हूँ O और एक या वर्ड।
ठीक है बाबा, ठीक है, धन्यवाद।
थैंक यू सर।
So as we seen in the video, the patient we ask the patient to cover his one eye at one time and ask him to read all the letters from top to the bottom, and we have check one eye at one time and check both the eyes separately. So how to record the visual acuity and how to write the result? We first the visual acuity is recorded as a section of fraction, like 6 is the testing distance and the bottom number should be the smallest line the patient is able to read. For example, if the patient is able to read the bottommost line, so the person has 6/6 vision, that is the normal vision. If the person is able to read one line above with the mark number of 9 or 2 lines above, that is the mark number of 12, then the patient would have vision like 6/9 or 6/12. If a person has vision 6/18 or even worse than that, then the person is said to have significant visual impairment.
You have a different kind of a chart in this particular slide as compared to the one which you have in the video. Would you like to say something about that also?
So this is the broken C chart or the landlocked ring chart. So actually this Snell's chart could be used in those persons also who are not able to read any language like English, Hindi or even the alphabets. So we just ask the patient from which side the ring is broken actually, or which side the C is facing, whether it is above, down or left or right. So even if the person is illiterate, that is he is not able to read any alphabets or any letters, so we can also check vision for those individuals also.
Okay, that is very nice. So we come back to the same topic, that what is the role, your role as a caregiver or a health worker. So you must ask in the case of, because we have just checked for vision through the Snell's chart, we are not able to, through the Snell's chart, detect any other problems that an elderly may be having as far as visual impairment is concerned. We have only checked whether he can see properly or not, but there are many other symptoms or signs which may indicate he has a problem with his vision. For example, blurred vision, which could be because of cataract, could be because of glaucoma, difficulty in recognizing faces, eye discomfort is something which may not be picked up by the Snell's chart. You may have increased sensitivity to light. So these are some of the things which are also important to ask. And look for any squinting or difficulty in walking in unfamiliar places, or if a person starts avoiding reading, then you may need to have little bit more concern and further question the older person regarding his vision. It's important, as for all other cases, that you need to screen all the older adults, and in case of any suspicion of the visual impairment, you must refer the ophthalmologist in case that you feel that it requires some kind of an intervention. So this is very important. Now we come to a very important skill, and that is how a referral form is prepared. Now we are going to prepare a referral form in reference to a person who has a visual impairment. But you must understand that a referral form you may require to fill a referral form or prepare a referral form for any of the conditions that we have been assessing. So a similar referral form may be required to fill for cognitive decline, for a hearing problem, but this is an example of how you can probably fill a referral form for a visual impairment, and probably you can modify and create forms for any other problems that you may be having. So maybe I think you can explain, Dr. Chirag, how they should go about filling this referral form.
Yes, so let us learn how to fill a referral form. So while referring to a specialist care, we must understand so what are the indications for referral actually. So after a screening is performed, a screening test is performed, if there is any problem, like problem in the vision, problem in the hearing, problem in the cognition, so if there is any problem encountered, then we must refer them to specialist care. If the function is reduced or declining, if the function of an older person is found to be reduced, or if it's severely declining over the time, then we must refer them to specialist care. And if the condition needs expert evaluation, like there is something medical you are suspecting that is beyond one's capability, he must refer them to specialist care. We must explain why the referral is needed, both to the patient as well as to the family members, so that they can understand the importance for going to the referral. And we also need to understand that early referral prevents major complications. So how to fill a referral form? These are the essential informations that include the patient details, that is the patient name, the patient age, as well as the patient contact number. We must need to write the screening findings, like what test we have done, what is the abnormal result we got, and what is the reason for the referral, and what is the urgency for the referral, whether it is any routine, whether it is a routine referral, whether it is an early referral or a very urgent referral, and whether there is any relevant medical history, like the patient is suffering from any diabetes, hypertension, any disability or impairment that the patient is having. We must mention them to the referral form also. So this is the example of a referral form, sample example of referral form. As you can see, the various domains are being written, like the patient details, including the name, age, address, the contact number, the reason for the referral, whether it is for the mobility part, for the cognition part, what is even the urgency for the referral, to whom we are referring, to the geriatric medicine, to the physiotherapy team, to the occupational therapist, or to any neurology or psychiatry. And in the end also, there are the details of the referring doctor, the referring health care provider. What is his name, what is his designation, and on what date he is being referring the patient to. So this is a sample form. And
I think this is very important, what you have told, that how a referral should be filled. And what is the main purpose of the referral? The main purpose is because it is documenting the present condition of the patient, which in a healthcare setting some point may be missed, but more importantly, he has documented this on a particular date. And as we know that during assessment and follow-up, the deterioration can happen. So when he goes to the healthcare center, there may be a difference in the status of the person, which can be picked up, that okay, this was the condition when the person was examined by the health worker, and this is the condition when the patient has now come to a healthcare center. So your role again as a healthcare provider and a healthcare giver or a health worker is very, very important, because you do need, it is you who is a connect between the health center and the patient, especially if he requires some kind of a assistance, some kind of advice, some kind of intervention. So you can only assess the conditions that when the referral is needed, you must prepare and hand over a proper referral form, in which you will explain where they should go and whom they should consult. It is very important that you stress on follow-up. That is, they have gone to the health center, but they may come back to you and they must consult you, they must give you the feedback, and they must be in constant touch with you, because you are the caregiver, that what has happened during the particular visit and how to, because you can follow up later on whether they are keeping in whether they are actually agreeing and following the advice that has been given to them by the healthcare institution or not, and whether when do they next need to go for a follow-up visit. You must ask them to carry all previous reports, and also you must review and monitor their progress regularly. Now we have completed these particular skills, and we will now take up the next skills that we require for the assessments. So coming to now the hearing. This hearing is again, like the vision, one of the most important components, in which normally the person, because of aging or with aging, we find most of the elderly have a problem in the hearing. So we do need to find a common screening tool for assessment of hearing loss, and to find whether they will require a further hearing assessment or not. So what is the need for assessment of hearing loss? It's because we know that hearing, as I said, is very, very common with increasing age, and sometimes it is often gradual and can go unnoticed. And there is difficulty in following conversations. They can be, how do you know that maybe having a hearing loss? And for example, he may have difficulty in following conversations. They may misunderstand conversations, and they may ask people to repeat themselves or to increase the volume of the devices. They will start avoiding social situations, and sometimes they may also have tinnitus and ringing in the ears. So an early action reduces the chances of falls and also improves independence. Now, what are the common causes of hearing loss? This could be because of natural aging, or it could be diseases like diabetes or hypertension. There can be side effect of medication. Sometimes a genetic effect can also have an impact on the hearing, and sometimes exposure to a long-term noise can also result in hearing loss. Now, the commonest test that is used for assessing hearing loss is the whisper test. And let us learn now how this whisper test can be performed. So, Dr. Chirag, again over to you, and let us understand how to do this.
So let us learn how to perform the whisper test. It is a very simple test to assess the hearing impairment in the oral adults. So before we begin, we need a quiet room, and minimal background noise should be appreciated. And we must explain clearly to the patient that I will whisper some words and please repeat what you hear. Check and before that also we need to check the ear canal for any visible wax, and we should also remove any hearing aids if the patient is using any for screening purpose. The sample the setup is a very simple setup, and there was no equipment needed. So let us know how to perform it. So the assessor should stand behind the patient at a distance of 1 arm's length or approximately 60 centimeter away, and we should ask the person to cover the opposite ear by pressing the tragus gently, and we then exhale and whisper certain words like 6K, 2, or simple words like ball, tree, banana, apple, and ask the person to repeat what he is able to heard or not. And we need to check each ear separately, and we also need to use different words for different ears in order to prevent false positives. And if the patient is unable to repeat, then there is this signifies impairment in the hearing ability of the person. So let's have a live demonstration to how to do whisper test with our Rawatji. तो नमस्कार बाबा जी। अभी हम आपकी सुनने की शक्ति की जांच करेंगे।
ठीक है जी।
तो इसमें आपको क्या करना रहेगा, आपको एक तरफ का कान बंद करना है, और मैं आपके पीछे खड़े होकर कुछ फुसफुसाहट से कुछ शब्द बोलूंगा। ठीक है। आपको बताने हैं कि आपको क्या सुनाई दिया, और अगर नहीं सुनाई दिया तो ये बताने कि नहीं सुनाई दिया। ठीक है। आप समझ गए बात? हाँ, समझ। कोई और कुछ डाउट्स वगैरह तो नहीं? कुछ नहीं। अपना दाया कान बंद कर लीजिए। क्या बोला मैंने?
आपने सेब, केला, कुर्सी बोला।
हाँ जी, बहुत बढ़िया। अब अपना दूसरा कान बंद कर लीजिए। संतरा, आम, केला, क्या बोला मैंने?
संतरा,
हाँ जी, और
सेब, केला।
ठीक है बाबा।
So you can tell the because our audience has not heard what you spoke. So was he able to repeat or not?
So the first three words that I provided, the person is able to repeat all the three words correctly.
From the left ear when he heard.
But when testing from the other ear, he is able to repeat only one word, and the two words he is not able to identify correctly. So that's why this signifies that there is a hearing impairment in the other ear, that is the right ear.
तो रावत जी, आपको कोई दिक्कत होती है सुनाई देने में? दोनों में से किसी कान में आपको लगता है?
कभी कभी
कौन से कान में लगता है?
इसमें, इस
कान में लगता है। तो टेस्ट में भी यही कान में दिखा है कि शायद आप इतने अच्छे से नहीं सुन पा रहे हैं, तो इसका फिर आप एक बार जांच कराना जरूरी है। ठीक है, तो आप अपने घर में बोलिए या आप किसी हेल्थ हॉस्पिटल में जाइए और दिखा के आइए कि क्या प्रॉब्लम है। कभी कभी वैक्स होता है, उसकी वजह से भी हो सकता है सुनाई ना दे रहा हो, तो वो एक बार हटाएंगे तो आप शायद उसके बाद अच्छे से सुन पाएंगे। ठीक है। So what is your role as a health giver or a health care provider or a health worker? Based on the results of the test, you may need to refer the patient to a specialist for any interventions, because as we also said over here, maybe it's just wax, but then it requires to be evaluated. In case of symptoms like sudden hearing loss, tinnitus or dizziness and balance problems with the hearing loss, you must refer to a specialist. So you must also inquire about these symptoms, because just a whisper test will not give you an idea about the tinnitus, about the dizziness that may be associated with hearing loss, which can have complicated or complex reasons which need to be evaluated in a healthcare facility or by a healthcare specialist. So you must also talk to the family members and discuss with them how this problem can be sorted out. So how can we demonstrate effective communication for older persons with hearing loss? Because it is important that the older persons there is another method, or there are certain strategies in which we can talk to the older persons. So how are we going to do that? Can you explain?
Yes. So while communicating with older adults who have hearing loss, we need to take care of certain things. Like we must speak slowly and clearly, and also our voice should be enough loud so that they can understand. We also should talk to them while facing directly to the person, because certain times they can also guess the words or what we are trying to convey them through our lip reading also. And we also make habit to use certain hand gestures while talking to them, so that they can get an idea of what actually we are trying to convey to them. And also we should keep background noise to be too low, or make the environmental noise not that much loud also. And we also avoid talking from another room, like we are in living room, they are in kitchen, and we are just telling them do this or do that. We need to be present in the same room while talking to the older adults with hearing loss. And we must understand that good communication reduces too much disability or problems in the elderly also.
Yeah, probably it also gives them a feeling of confidence that they are, not suffering from such a kind of a disability, and they are able to cope up with it. So then it is also important to create the right communication environment. As you said, that we must ensure that there is good lighting on the person, bright light should not be there, no background noise. We need to make sure that the person can see our lips, because with time, when a person is having a hearing loss, it is for any individual that they start doing lip reading. So when you are facing the person and talking, then of course they can do lip reading, and by facial expressions and by gestures also, they get a lot of understand what of things what are being said. Would you also like to tell how we can explain to the family in cases where there are elderly with a hearing loss in the family, how can the family help to cope up, to help the older person cope up with this hearing loss?
Yes, so for educating the family as well as the caregivers, we must try to educate them to recognize early signs of hearing loss. Like the patient is not able to follow the telephonic conversations or follow the like normal conversations during the home, or they have trouble watching the news, hearing the news, watching the television, or while talking to someone on the phone. So they should recognize these early signs of hearing loss. And we should also encourage them to undergo regular hearing checkups, like 3 monthly, 6 monthly, periodically the hearing checkup should be done. We also want to teach them that if the older person is not able to follow their commands, it could be like he is not able to hear them. It's not like he wants to ignore them or is not able to follow their commands. It could be just a hearing loss. So they should not feel frustration over the older adults, and they should get them screened for the hearing loss. Also, we should try to learn these practice like facing the person. They should speak while facing the person, speak clearly, slowly, as well as loudly, maintain proper distance, as well as use of certain gestures and proper lighting also. And we should also make them aware of certain diseases or certain medications that might the person is consuming and affecting their hearing power also. Good family support improves communication, safety and quality of life in these older persons with hearing loss.
Yeah, as you said, it is very, very important for us to also educate the family along with the older person. The family should be empathetic towards the older person and not offer their sympathy, because that is something which is, it is not dignified to do. It is hurting the other person as an elderly who has had a kind of, a kind of a role of a head of the member of the family. So that's not a good, it's quite derogatory to do that, but they should be empathetic. So now we come to the last tool for today, and that is for the screening tool for assessment of depression. And we know that it is important to see whether they are having certain problems with the mental health. So need for assessment of depression, common and often overlooked in older persons. It can sometimes be mistaken for normal aging or other illness, and it is very different than in adults sometimes, the presentation, because sometimes depression may be just feeling sad as far as the adults are concerned, but in an older person they may not say that they are sad. If you ask them, they may not say that we are sad, but then they may just say that no, we are very tired, we don't want to go for a particular activity, or we don't want to talk to somebody because we are feeling tired, or they may have trouble falling asleep, or they may just be disinterested in whatever is going on around them, or which is being any interactions which happening with them. So this depression in turn affects the mood, physical health and daily life of a person. But the good part about it is that it is treatable. So that is very important. And what are the common causes of depression? So common causes is that there is loss of social contact because of maybe dependence, loss of mobility, maybe because they are secluded, they have just now retired. So a lot of things that everybody has cut off ties with them. So there is a lack of social contact which can increase their chances of going into depression. There can be chronic illness. The illness itself may lead to depression because of the illness or the medication, or because the illness itself causes them to retract and be socially isolated. Sometimes the loss of loved ones has a great impact and can also result in depression, like also the financial difficulties and the disabilities or dependence. The disabilities for any illness or any diseases can also result in depression. So it is very important, as we saw, that the signs can be very subtle. They may not be very obvious signs. So it is very important to screen all older adults for depression, because otherwise they will it is like a vicious cycle. The depression will further lead them to be socially withdrawn and will have an impact on the other issues that they are having. They may not want to become mobile. They may start having cognitive decline. So it's very important to be able to screen the adults for depression. So the most common scale that is used is the Geriatric Depression Scale. This tests if the older person is under depression. So let us learn how we can perform it. So Dr. Chirag, can you tell us more about this Geriatric Depression Scale?
So let us learn how to perform the Geriatric Depression Scale, that is the GDS 15 scale. So it is a simple screening tool, consists of yes or no questionnaires, and it focuses mostly on the mood of the patient, the interest and the enjoyment, the energy, the feelings of hopelessness or any social withdrawal feelings he is having or not. So coming to the scale part, it consists of, these are the 15 questions that are on the screen. So these we have to ask the patient to answer them as yes or no only, whether the answer is yes or no. And if the answer is depressive, that is marked in the board letters, then a score of 1 point is been given to the person. And if the score is normal only, then a score of 0 is given to the person. So as you can see in the scale, there are certain board letters on the yes or no. If the board letter is being the answer, then the score of 1 point is being given. So a total score of 15 points is being in this scale. And if a score of 5 or more was there, so it indicates that the patient might be suffering from depression. So these questions should be asked as exactly as written in the scale, and we should speak slowly and allow enough time for the person to comprehend these questions. And it is must to note down that we should not suggest any answers to these questions. We let the patient or the person to answer these questions on their own only, and we should we only record the responses as they give us to them. So this is the GDS scale again showing in the picture.
So I think this is one of the most important tests, because all the other tests that we have been doing are because of the physical disabilities or physical impairments or physical problems that the elderly may be facing. This is the only test we do for a mental health of the elderly. And so your role as a health giver, caregiver or health worker is that you identify the older person at risk. You ensure that immediate safety should be present, because if it is not there, immediate safety, because they may go into depression and they may go into for suicidal thoughts, and in such cases immediate help is required. Check for reversible causes again in this. For example, pain may lead to depression, continuous pain, medicines and even illness. You may need to refer them to a geriatric medicine specialist or a psychiatrist. And again, as for all other cases, you need to follow and monitor regularly. So this is very important, and these are your roles. So it's very important for you to understand that all the assessments must be done very meticulously as they have been given in the assessments. They should be followed and they should be recorded. You should refer wherever you find that the assessment shows that they are not up to the mark and they are at a risk for any of the suffering, or there is a decline in the intrinsic capacity. And then you must also make sure that you regularly follow them up, because you are looking after the older person as a caregiver. So it is important that you record, you follow up, and you advise as has been given by a healthcare provider, or a doctor or a nurse or a nutritionist or a physiotherapist. So you must follow their advice. You should not on your own advise any of the older persons or the family members. So if you have anything, one or two things to say, then we would like to also share our acknowledgements for this particular this thing.
So this teaching class, as we have undergone just right now, is like for the intrinsic capacity. So we learn how to assess the physical as well as the mental capacity, including the locomotion, the cognition, the psychological well-being of as well as the vision as well as the hearing part of the older adults. We have seen this. And also we learn about the environmental management, the environmental hazards in the kitchen, in the living rooms that can cause disability or fall to the older adults. And we also learn about the role of the caregivers, the role of the family members, how to speak to them, how to effectively communicate with them, how to not make them feel alienate or isolated. We also learn how or when, if they detect any abnormality, they suspect that this capacity of the older person is impaired, they should refer them, how to refer them, what all steps they should follow, and what is the urgency of the being referred.
I think important points that we have actually told is about the malnutrition also, because some of the things are quite subtle. I mean, even whether they are at risk of malnutrition or not, it's not really, it doesn't come out. Everybody feels that individuals at their old age tend to be frail, but then it is important for us to Similarly, for hearing and vision are two things in which we feel that, their hearing is going to be impaired in any case. So we don't really, as a family member, feel that we need to go for extensive evaluation or even for screening. Similarly, for the visual impairment, we feel that there is going to be cataract or there is going to be a loss of vision because of presbyopia also, and so we generally do not tend to go in for the screening test. But these tests all are very, very important and they must be carried out, and I think that is very important. So thank you very much, Dr. Chirag, for taking out your time and for such extensively explaining all these screening tests. And before we close, I think we would like to place on record our acknowledgement, and because this is part of our program and the practical module which is on basically intrinsic assessment of intrinsic capability. We had Dr. Abhijit Rao, who is also a geriatrician from AIIMS New Delhi, who was a writer for all these assessments. Dr. Sunny Singhal, who was the editor along with me for all these assessments that we have shown. And of course, we would also like to place on record that all the educational, the teaching material, the tests that have been used are the standard geriatric screening tools. We also acknowledge AIIMS New Delhi for providing the demonstration videos. We thank Mr. Rawat, who has come for the video presentation and demonstration, and also we have used the artificial intelligence tools for the image generation which has been created, and for simple explanation and for making the PowerPoint more expressive and explanatory. So with these few words, I would like to thank all of you, and I would like to again reiterate that we have got admissions open for this particular program, which is a 6 months program. Admissions are online and can be accessed through our www.ignou.ac.in, and the name of the program is Certificate in Geriatric Health and Care Program. So looking forward to involving you further on with us through this particular program. Thank you very much.